GutPunched, Alzheimer's and Caregivers. Navigating the insidious illness of Alzheimer's is something nobody asks for. The disease sneaks up on you and your loved one, and it feels like you've been sucker punched in the gut. Then you ask, where do we turn for help? Who do we call? What do we do? These questions and more are what we hope to answer and give you some direction and hope. Now let's join our host, Jeff Edwards.
Greetings and welcome. Here we are again, GutPunched, Alzheimer's and Caregivers, episode 30. Or are we done with hurricanes for this year yet? Hope you had a good week. Can you believe that we're already going into November? Got any stress? Or are you chilling? Well, we're close to the end of the hurricane season, and do you believe they're talking about the possibility of another storm forming in the Caribbean? Come on, make them stop, please. Okay, let's get serious. This week, we'll hear about 3 household products that raise dementia risk. We'll take a snapshot look at the guide program, and then we'll dig a little deeper into the model overview and then the model purpose. Now, this is a new program. It's unique. It's for caregivers and their partners. We'll do a little more each week, preceding an interview with Dr. Adam Perry from HealthSpan Partners, and I believe that's scheduled for early November. And then we'll update you on some of the Walk for Alzheimer's locations for the next few weeks. Okay, what are the 3 rules or suggestions we follow here at GutPunched, Alzheimer's and Caregivers? Number 1, you got to take care of yourself, because if something happens to you, who is going to take care of your loved one? You can't do it alone. You need help. Find good caregiver groups or network with friends and relatives. And number 3, make a list of people, friends, relatives, coworkers who have offered to help you in time of need. And then make a list of things you need done but can't do yourself because caregiving duties are overwhelming. Use the lists, start at the top, and keep going till you get what you need done. You'll find it very helpful. All right, let's get to it. Here's an article from Newsmax by Lynn C. Allison. 3 household products that raise dementia risk. A new study from Chinese researchers highlights the relationship between cognitive decline and common household chemicals. Previous studies have shown links between chemicals and cancer, respiratory illnesses, and damage to the central nervous system. Now, scientists believe that overexposure to 3 household products in particular may increase your risk of Alzheimer's disease. The data compiled in the latest study show that regularly using disinfectant cleaners, air fresheners, and anti-caries products such as fluoride to prevent cavities in teeth may contribute to cognitive decline in adults 65 and older. The researchers noted that frequent combined use of these household products increase the risk of dementia even further. While previous studies have focused on the effect of chemicals on children and pets, the latest study reveals how they can affect people even later in life. Since seniors tend to spend more time indoors, this also increases the risk of exposure. The impact of indoor air quality on health status cannot be ignored, the researchers wrote. This conclusion bolsters yet another reason why getting outdoors is good for your health. Now, according to the Alzheimer's Association, nearly 7 million Americans are living with Alzheimer's. That number will nearly double by 2050, says The Healthy. Alzheimer's disease is on the rise in developed countries, and some experts believe there is a correlation between overzealous hygiene and increased risk of developing the disease. It's called the hygiene hypothesis, a theory that suggests that modern environments are too clean, which can lead to an inadequate immune system and an increased risk of allergic and autoimmune diseases. Molly Fox, a biological anthropologist from UCLA, led a study across 192 countries that suggested that the lack of exposure to bacteria affects the immune system, leaving your brain at risk for inflammation. A better understanding of how environmental sanitation influences Alzheimer's risk could open up avenues for both lifestyle and pharmaceutical strategies to limit Alzheimer's prevalence, she said. While good hygiene is important, experts advise using everyday soap and avoid all the unnecessary chemicals whenever you can. That's 3 household products that raise dementia risk.
We'll be right back to GutPunched, Alzheimer's and Caregivers.
1 in 10 Americans over 65 has Alzheimer's disease, and 2/3 are women. For more information, go to brightfocus.org.
This is GutPunched, Alzheimer's and Caregivers.
Well, last episode 29, we mentioned the GUIDE program. I had an opportunity to talk to Dr. Perry, who was involved in this program and resides in Southwest Florida. We had a great conversation. I got some more information, and we're going to talk in detail in the next couple of weeks. So over the next few episodes, we're going to keep going back to the GUIDE program because it is a very, very interesting and very helpful program. And they call it the GUIDE because it's Guiding an Improved Dementia Experience Model. Information for patients and caregivers. Now, what is GUIDE? Your doctor or care team may be participating in a new program called GUIDE. This program offers enhanced services for dementia care and support for caregivers, a relative or unpaid non-relative who helps with activities of daily living. Now, the goals of GUIDE are to improve the quality of life for people living with dementia, enhance support for caregivers of people living with dementia, and help people living with dementia stay in their homes and communities longer. Now, services for people living with dementia and their caregivers. Here's one: comprehensive assessment and care plan. Get an assessment to identify your individual health needs and to build a care plan that is tailored to provide the services you need. Another one: caregiver support. A relative or unpaid non-relative who helps as a caregiver can receive education and support, such as direct communication with a care navigator when they need it. GUIDE respite services, and they could be provided up to an annual cap, so caregivers may take a break when they need to. Support comes from local in-home respite providers, adult day centers, and nursing homes. Then there's coordination and support. Get connected to community-based services like meals and transportation. Care teams will also work together to coordinate clinical and support services. And there's 24/7 access. Care navigators help you get care and 24/7 access to a care team member or helpline to ask questions or get support. How to access GUIDE services and supports. Now, signing up for the GUIDE. Learn about GUIDE or be identified as a potentially eligible patient. You can visit with a doctor or care team participating in GUIDE and get a comprehensive assessment of your health needs. At the end of the visit, a doctor or care team member will submit a form to CMS. If you are eligible for GUIDE, you'll get more information about next steps from the care team. Questions? Find a participating dementia care program on the website or email the GUIDE model team at GUIDE, G-U-I-D-E, model team at CMS.hhs.gov. That's GUIDE model team at CMS.hhs.gov. Now, patients must be enrolled in original Medicare Parts A and B and meet other eligibility requirements. Patients are always free to see any doctor or hospital that accepts Medicare. I'm going to give you an example of how this program can help. Mildred is an 86-year-old woman living alone with moderate dementia. She has regular appointments with her primary care doctor, dentist, optometrist, and gets her medications from a local pharmacist. Her caregiver, Anne, is her 35-year-old granddaughter who visits daily with help in housekeeping and personal care tasks. Anne is a mom with a full-time job. Now, the challenges before GUIDE. Mildred was experiencing worsening symptoms related to her dementia. Her primary care doctor wasn't equipped to treat her dementia. She needed help getting to appointments and taking medications. And Anne was burnt out as a caregiver and wanted to find Mildred a nursing home, but it was too costly. So what happens when she gets the help and support from GUIDE? Mildred learns about GUIDE from her doctor and starts working with an interdisciplinary care team. Mildred's care navigator connects her to transportation services and gets caregiver training to cope with Mildred's symptoms and her own stress. And Mildred receives GUIDE respite services, allowing Anne to take a break. So that's kind of a snapshot of the program. We're going to get into this a little bit more in depth here in just a little bit. The guide model focuses on comprehensive, coordinated dementia care and aims to improve quality of life for people with dementia, reduce strain on their unpaid caregivers, and enable people with dementia to remain in their homes and communities. It will achieve these goals through Medicare payments for a comprehensive package of care coordination and care management, caregiver education and support, and respite services. Now, GUIDE delivers on Biden's administration's April 2023 Executive Order 14095 on increasing access to high-quality care and supporting caregivers. And that directed the Secretary of Health and Human Services to consider whether to select for testing by the Center for Medicare and Medicaid Innovation an innovative new healthcare payment and service delivery model focused on dementia care that would include family caregiver supports such as respite care. It also advances key goals of the national plan to address Alzheimer's disease, which was established through the Bipartisan National Alzheimer's Project Act, NAPA, and has for over a decade accelerated federal actions to optimize the quality of care for people with dementia and their caregivers while advancing research towards a cure. The guide model builds off this extensive coordination within HHS and major input from various external stakeholders. Now, the highlights are dementia affects more than 6.7 million Americans in 2023, with 14 million projected cases by 2060. People with dementia often have multiple chronic conditions and receive fragmented care, leading to high rates of hospitalization and emergency department visits. They also may have behavioral health symptoms and often need 24/7 care. The challenges of managing health care, providing constant support, and dealing with behavioral and psychological symptoms of dementia can present a significant mental, physical, emotional, and financial burden for caregivers and disproportionately impact Black, Hispanic, and Asian Americans, Native, Hawaiian, and Pacific Islander populations. The guide model will set a standard approach to care, including 24/7 access to a support line, as well as a caregiver training, education, and support services. This standard approach will allow people with dementia to remain safely in their homes for longer by preventing or delaying nursing home placement and improve quality of life for both people with dementia and their unpaid caregivers. To reduce disparities in access to dementia care services, the guide model incorporates policies to enhance health equity by ensuring that underserved communities have equal access to the model intervention. And the model purpose is, despite its prevalence, many people with dementia do not consistently receive high-quality coordinated care, and as a result, they experience poor outcomes, including high rates of hospitalization, emergency department visits, and post-acute care utilization. They also experience high rates of depression, behavioral and psychological symptoms of dementia, and poor management of other co-occurring conditions. Now, dementia also significantly impacts the family and other unpaid caregivers, who often provide significant amounts of assistance with personal care, finance, household and medication management, clinical coordination, and other care. Many caregivers for people with dementia, who are often Medicare beneficiaries themselves, report high levels of stress and depression, which negatively affect their overall health and increase their risk for serious illness, hospitalization, and mortality. Through the guide model, CMS is testing an alternative payment methodology for participants that deliver comprehensive, coordinated dementia care. Under the model, participants will assign people with dementia and their caregivers to a care navigator who will help them access guide services and supports and non-guide services and supports, including clinical services, non-clinical services such as meals and transportation through community-based organizations. The guide model will also enhance access to the support and resources that caregivers need. Unpaid caregivers will be connected to evidence-based education and support, such as training programs on best practices for caring for a loved one with dementia, Model participants will also help caregivers access respite services, which enable them to take temporary break from their caregiving responsibilities. When used over time, respite services have been found to help unpaid caregivers continue to care for their loved one at home, preventing or delaying the need for facility care. The model is also designed to reduce Medicare and Medicaid expenditures, primarily by helping people with dementia to remain at home and reducing hospitalization, emergency department use, the need for post-acute care, as well as long-term nursing home care. The guide model aims to address the key drivers of poor quality dementia care in 5 ways. 1. Defining a standardized approach to dementia care delivery for model participants. This includes staffing considerations, services for people with dementia and their unpaid caregivers, and quality standards. Number 2, provide an alternative payment methodology to model participants. CMS provides a monthly per beneficiary payment to support a team-based collaborative care approach. Number 3, addressing unpaid caregiver needs. The model aims to address the burden experienced by unpaid caregivers by requiring model participants to provide caregiver training and support services, including 24/7 access to a support line, as well as connections to community-based providers. Number 4, respite services. CMS pays model participants for respite services, which are temporary services provided to a beneficiary in their home, at an adult day center, or at a facility that can provide 24-hour care for the purpose of giving the unpaid caregiver temporary breaks from their caregiving responsibilities. And number 5, screening for health-related social needs. Model participants are required to screen beneficiaries for psychosocial needs and health-related social needs and help navigate them to local, community-based organizations to address these needs.
We'll be right back to GutPunched, Alzheimer's and Caregivers.
Are you the caregiver for someone living with dementia? You're not alone. The Dubin Center in Fort Myers offers free educational classes and support.
The Dubin Center has given me a shoulder to lean on.
Call today or visit us at DubinCenter.com to learn more.
This is GutPunched, Alzheimer's and Caregivers.
And don't forget, register today for Walk to End Alzheimer's. Together, we can end Alzheimer's disease. Find your 2024 walk. Go to alz.org. That's the Alzheimer's webpage. And on that, you'll see information. And it's held annually in more than 600 communities nationwide. Walk to End Alzheimer's is the world's largest event to raise awareness and funds for Alzheimer's care, support, and research. Register for your local walk. You can start or join a team and invite others to walk with you. Or you can start fundraising and sharing. The Alzheimer's Association makes it easy with tools like Facebook fundraisers and their ALZ fundraising app, and there's a lot more. Also, join us on Walk Day. Come together for an inspiring community event that celebrates our commitment to ending the disease. Coming up, walks near you: Boca Raton on November 10th, Davie, Florida, November 23rd, Daytona Beach, November 9th, Fort Myers, Florida, November 16th, Jacksonville, Florida, November 9th, Lakeland, Florida, December 7th, and Miami, Florida, November 16th. Well, I think that will do it for this week. Time to check the tropical weather report again. We hope we were able to provide you with a couple of bits of helpful information. Next episode, we'll have more on the guide program. Now, this is something you might want to share with your friends or family. You can look it up online if you want, but we'll continue to bring you more information on it, along with some of the links. If you know someone who has a family member or a friend who is dealing with a loved one who has Alzheimer's or any type of dementia, please let them know about this podcast. For more information, you can check out the Alzheimer's Support Network at alzsupport.org/about us, or check out the Dubin Center at DubinCenter.com. To find your local chapter of the Alzheimer's Association, you can visit alz.org/local resources/find your local chapter. and I almost forgot, I've been getting a lot of requests from listeners who really enjoyed the episode with the classical music and the effects on the brain. And I think that was episode 11. So we're looking into trying something like that again sometime soon. Maybe for the holidays. Who knows? The website is GutPunched.com and the email jeff@GutPunched.com. Thanks for joining us, and please come back again for more. God bless.
This has been Gut Punched, Alzheimer's and Caregivers, with your host, Jeff Edwards. Don't forget to hit that like button and subscribe to us on all the platforms like Spotify, Apple, Pandora, and more. If you have a question or want to get in touch, our email is gutpunchedac@outlook.com.